congratulations on your pregnancy. Usually, couples visit me for the first pregnancy visit after they have done their preconception counseling with me. And so we would build on that visit in this first pregnancy visit. This video is an overview of what you might expect in the first pregnancy visit. Let's start with talking about your physical health. For your physical health, we would do anything that still needs to be done from the preconception visits, such as a breast exam or a cervical screening test. We would then check your vital signs, especially your blood pressure, do a thorough physical assessment, and record your height, weight, and BMI at the start of pregnancy. We would do some tests, including a urine test and an extensive panel of blood tests. If you haven't already, we would advise you to stop smoking, stop drinking alcohol, and stop taking any illicit drugs. We would discuss your nutrition, including your current diet, and whether it is meeting your nutritional needs. For example, a strict raw vegan diet might require supplementation. We would start routine supplements as well, which include folate, iodine, and iron. We would use a higher dose of folic acid if you're high risk, which means if you use epilepsy medication, if you have pre-pregnancy diabetes, if you've previously had a child or a family history of neural tube abnormalities, or if you have a body mass index above 30. We would discuss what foods to eat and give you a handout on that as well. Usually, we avoid foods that have high mercury that could cause infection, for example, soft cheeses, raw meat, deli meat, raw eggs. We would limit caffeine to 1 coffee a day. We would encourage you to eat healthy food and aim overall for 12 to 16 kilos of weight gain on average during your pregnancy. We would discuss routine pregnancy vaccinations, including the annual influenza vaccination, COVID vaccines, the whooping cough vaccine at 20 to 32 weeks, which is also recommended for family members. And lastly, we would discuss a new vaccine, the RSV single-dose vaccine, which is given at 28 to 32 weeks as a single dose, which can protect your baby from a potentially serious respiratory infection. We would have already checked your blood tests for immunity to rubella and varicella before pregnancy, and usually we would have already given you an immunization for those before pregnancy if that was required. Let's talk about some physical changes to your body during pregnancy. Your body changes significantly during the pregnancy journey. In the first trimester, you might experience fatigue and nausea. In the second trimester, you might experience the honeymoon phase, or the start of feeling baby movements, which happens at around 16 weeks. In the third trimester, some women experience that they need to urinate much more often because of the pressure that baby puts on their bladder, and some women experience pelvic pain. In this first pregnancy visit, we would discuss your mental and social well-being as well. Depending on your risk and cultural background, your doctor might go through something called the Edinburgh Depression Screening Scale with you, which includes questions about your mood, sleep, and ability to enjoy life. We would also discuss if you feel safe at home, if you feel scared or controlled by your partner, and make sure that you know about the supports available to you if you have been experiencing any of those. I would also discuss miscarriage with my patients. Intensely. There are so many support services available to you if you experience that. No support services can ever be enough, but there are so many people who care, who will surround you with love and affection, and who will take that healing journey with you. We would also discuss the antenatal care options available to you, and I would give you some information that you can take with you to help you decide. You can think about public versus private pregnancy care, midwife versus obstetrician care in private, and some women also choose to have a doula with them to support their birth. When asking you for your results from the blood and the urine test, we would usually do your referral to your preferred antenatal care provider once you've decided. Now let's discuss the mental changes during pregnancy. Pregnancy is like running a marathon a day, so you will feel exhausted. Take care of yourself, give yourself time to rest, and take things easy. You are growing a whole human. You may require more sleep, have less patience, and you may notice that you cry more easily or forget things easily, like people's names. Now, talking about the social changes, you're going to be starting a wonderful new chapter of your life. It's important to plan for this financially and logistically. You may need a bigger car, research car seat safety, research baby wearing safety. Think about your values and whether you want to use cloth nappies and how you'll integrate your values into your parenting. There is so much to think about. And the last idea that we will discuss during this important visit is how important it is to enjoy this beautiful, marvelous journey. Even with the vomiting and pelvic pain, most people enjoy this time and remember it with fondness and love. Especially if this is your first pregnancy, this is an exciting, incredible time of transition. You will learn so much about your body and yourself. Embrace this time of transition and enjoy the yoga, reading books, listening to podcasts, talking to other people about their experiences, journaling and reflecting on what kind of life you want to build for yourself and your family.